Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. It is clearing up. It's a beautiful day, and it's a busy, busy day in the news business here in Rhode Island. Take a look at all the headlines over on Go Local. But I don't want to hold things up. I want to jump over to CharterCARE. Dr. Pohl is one of the top physicians over there, and he leads a team that does a lot of innovative work on bariatric and other weight loss strategies. Dr. Pohl, thanks so much for joining us.
Thank you for having me.
Yeah, talk a little bit about, we ran a piece about, I don't know, about 3 weeks ago about Rhode Island's ranking for health, specifically obesity, and it wasn't a good picture. Rhode Island ranked exceptionally high, and it ranked exceptionally high in comparison to many of the New England states. Talk a little bit about what's the situation here in Rhode Island.
Yes, unfortunately, weight is a big problem in health in the United States and the Western world. Over the last 50 years, food become available everywhere, and as you know, you drive down the road and you got like 3 or 4 different choices what to buy, and with that, the weight of most people went up. So obesity has gone up and up and up over the years. I've started here in the year 1999 and started our weight loss program in 2000. And even then, when I gave these interviews and talks, about 25% of the people in Rhode Island were overweight and obese. That means they weighed, let's say, 30, 40 pounds over. And even at that time already, in order to qualify for my surgery, for our surgery, they would have to be almost like 100 pounds over. And even at that point, 5% of Rhode Islanders would qualify for this. So that's for 1 million people, that's already 50,000 people. So at any given time, even 20 years ago, there were 50,000 people in Rhode Island who were so overweight that they would qualify for weight loss surgery. And unfortunately, not just in Rhode Island, but all over the country, those numbers have gone up and up and up. And nowadays, we see that sometimes in some states, even 30, 40% of people are morbidly obese to the point that they would qualify for surgery. Now, Rhode
Dr.
Island is
Yeah, no, I was just going to say,
yeah,
did the pandemic add to that problem? And did we
yes.
see, we've read a lot about sort of people doing one of two things, working out a lot to relieve the stress or eating a lot to relieve the stress of the pandemic.
Yeah, that people have looked at this now from public health point of view, and the numbers have gone up. People are, as everybody knows, being more sedentary, more at home. And if you're bored, if you're at home and there's food everywhere around you, what do? You eat. That's just a natural thing. And so, yes, the numbers have gone up, and that's maybe part of the reason why this is. But all these public health numbers are tracking numbers over the last few years, and it's gone up and up and up even without the pandemic. So it's a natural trend.
Talk a little bit how you intervene, what strategies you work with people, and then tell us about how bariatric works or doesn't work, what the
Yeah,
limitations are.
yeah, thank you. So in order to qualify for our program, people have to be really a lot of overweight. So we always encourage people to lose weight on their own. If someone weighs 5, 10 pounds over, there are many ways, many programs out there, smartphone based, dietitian based, behavioral based, gyms, everything out there. Lots of different approaches. Every person is individual and has a different way of dealing with this and how it works for them. Unfortunately, once a person has gained so much that they weigh 100 pounds over, it's really hard to lose weight on your own. You can still lose 5 or 10 pounds, but if you have to lose 100 and then keep it off, which is even the bigger thing, it's very hard. So for our program, people have to be really overweight, and there are certain numbers goes by something called body mass index that they need to qualify. So if someone is completely healthy, they need to have a body mass index of 40 and higher. And then they want to see a weight loss surgeon. They call the offices up and will then put them in contact with the surgeon. Surgeon sees them, goes through all the choices. But even then, we don't want to just do surgery right away because we do think that people have to take some responsibility and learn about all this. So they do see a dietitian first. They see a mental health provider first. And if they have medical problems, they get screened for medical problems. And if all this kind of falls in place, then we offer the surgeries. And the reason why surgery is offered is because it works. we know, unfortunately, everybody who's trying to lose weight is you lose 5 or 10 pounds, it slows down, you get frustrated, you say, what the heck, it doesn't work for me, and you start eating again. And it's a yo-yo thing. It goes up and down, up and down. And the good thing about surgery is it breaks through that problem, and people lose a lot of weight to start with. And the more important thing is with the surgery, they keep a lot of weight off, and that's the advantage.
Talk a little bit about those measures, that sort of that trending. You implement the surgery. What are you seeing 3 years out, 5 years out, 10 years out after for your patients?
Yeah, so everybody loses weight initially. That's just a given. The first year, everybody's happy. We call this the honeymoon because everybody is just very joyful and lots of energy and so forth, and they can't eat much and they eat healthy. But again, I tell everybody, life happens, stress happens, temptations happen. So if they don't stick with it and keep basically in mind that they have to change their lifestyle, not rely on surgery completely, and people think the good thing about the surgery is still like 8 to 10 off. So that's a huge number. 8 out of 10. If you compare this to diet and exercise, where barely 1 out of 10 people can keep their weight off. So we're 8 times better than that with surgery, particularly with a lot of weight loss. And we're not doing this just because people want to look good or so forth. This is not a cosmetic surgery. We're doing this for health. And because obesity, weight is at the root of almost everything that we have in our society. I mean, overweight is the roots for diabetes, high blood pressure, cancer, liver cirrhosis. All these things come from weight. So because we treat the weight, people live longer after surgery. People don't have their diabetes anymore. They don't have blood pressure anymore. They even liver, fatty livers, they get reversed and the liver becomes normal again. So these are all the reasons why we do the surgery. That's what we see in the future. People just do better, live longer, and live healthier.
Dr. Pohl, who should consider such a surgery and who shouldn't consider such a surgery?
Consider it again. It depends on a little bit on how much a person weighs, how much overweight the person has, and you can look this up on our website. This is a number you can look up on the iPhone or on any phone. Sorry, on the smartphone, any phone, and it's called the body mass index. So everybody who has a body mass index greater than 40 should look into this, because even then, I mean, the worst thing is cancer. No one wants to get cancer, but even cancer rates are doubled in certain areas when their body mass index is just 40. So everybody should look this up and see if they're qualified, and then start the process. And definitely, if the person has diabetes or poorly controlled diabetes, I mean, this is the surgery to do it. There's sometimes people leave the hospital and they're off their insulin. They don't take diabetes medications anymore. People are at high risk, even of like breast cancer, for example. I mean, the surgery helps in preventing the breast cancer formation in the future. So these are kind of like basically everybody who has a body mass index greater than 40 can have the surgery, should do something about it, and then particularly people with certain health conditions who should not do the surgery.
Yeah, please. Yeah.
It's a tough one. Really, we don't have many reasons why we don't do the surgery. But if someone is really completely has a horrible eating habit, and we know that they're going to fail because they're going to eat whatever, and they fail psychologically, that would not be a good reason. But it's hard to pre-screen this. People who are actively doing drugs, actively alcoholics right now, those people we don't do surgery on. But everybody else, yeah, they qualify.
And then, just on the macro level as the last question, how do we break this cycle of obesity? How do we transform our society? It's interesting, the state has $1 billion to spend on improving the state of federal funds. And one of the things that I have not seen, I've seen rescue money for hospitals and some other healthcare initiatives, but I haven't seen any major initiatives to make Rhode Islanders healthier. Build more walking trails, build more indoor tracks, sort of all the things. Certain states like Minnesota, they have indoor tracks, a big winter state, and they have lots of indoor facilities. Why don't we think that way here?
Yeah, I can't answer for them, unfortunately, but I know that. I mean, I know that the state is actually looking, because I'm on the board of the Royal Medical Society, which is very involved in this, and we hear from top level speakers from the House and from the government, and Blue Cross, the CEO of Blue Cross was give us a talk the other day, and everybody's interested in making people healthier. I think they truly are. I think the approach is difficult with weight, because everybody needs to eat. So you can't tell people don't eat. I mean, if it's drugs, you tell them don't take the drugs. If it's smoking,
Right.
you tell them don't smoke. If it's alcohol, you don't need to drink. But eating, you need to eat. So to take food away from them, you can't. It's hard. So food is everywhere, and obesity is kind of like accepted in our society right now. We just accept that people are overweight. And if you don't, then you kind of like you're the bad guy because you pointed out that someone is overweight, and it's just a personal choice. So I think it just needs to be more on the forefront to say weight is a medical health condition, and it's the root cause for so many other things. So don't give the patients just pills for diabetes and pills for blood pressure and a new knee replacement and a spine surgery, because the main reason was the weight.
Yeah.
So if they didn't have any problems, then if they weren't overweight, they wouldn't need all the other things. But the only way you can do this is basically kind of make it expensive. And that's how I do.
That's usually the trigger for most everything.
Yeah.
Dr. Pohl, I really want to thank you for taking the time and connecting with us. We'll get this out to everybody and how to connect to you, and appreciate it. Listen, it's an incredibly important public health issue.
Yeah.
You know, you saw during the pandemic too, you know, especially for younger folks who contracted the virus, a lot of those who passed away were heavier individuals and just body could not fight the virus. So
right.
thank you so much. Speaking about the virus, numbers ticked up a little bit in the last couple of days. Transmission rates up to 146 per 100,000 over a 7-day period, which is not as high, obviously, as it's been, but it is about 50% higher than the low last week. So it is important to look at that. And I encourage everybody, I've gotten my booster, first booster. I'm going to go get my second booster next week. Get your booster shot. 90% of Rhode Islanders were vaccinated. Only 40% have gotten the booster shot. It's incredibly important, and your level of protection has waned over the past few months. Get protected, have more confidence, enjoy the summer much better. Thanks everybody for tuning in. We'll have much more on Go Local throughout the day. Thanks.